You're listening to Radio Cosmos.
All night long.
Bravo! My compliments, little lady.
Commercial!
Break for 30 seconds.
You are now listening to BaaD Radio.
Hello and welcome to BaaD Radio. BaaD stands for Business at a Distance. This is a show about local businesses and business networking. We are here in the News Radio WFLA Orlando studios from 11 a.m. to noon every Sunday, and I am your host, Angela Smarito. Before I jump into the show, I want to give a shout out to some of our show sponsors because without their support, we would not be here now. First off is Forge IT Consulting, providing a fully outsourced IT department with a personal touch for small business, and Osteopathic Health of Orlando. They offer integrative medicine and regenerative medicine and so much more. Visit osteopathic.healthcare. So we have a special guest today. His name is Dr. Ryan Naughtin with Beach Medical, and I already told him he's not allowed to wear the sunglasses. But he defied me, so now I'm just going to have to just rail you on the radio. So you done screwed the pooch, my friend. Sorry. Well, welcome to the show.
Thanks for having me back.
Pull that microphone closer to you.
Thanks for having me back.
Yeah, he already told me that he's in chill mode because he got done putting together a big proposal yesterday and sending it out, which I understand how that feels. It's kind of hard to put your brain back into operating order after you put together a proposal of such size. So this is your second time on the show. The first time we had a really, really good show and we got some really good content from it. And I think that we were able to give the audience a good idea about Beach Medical and what some of the services that you offer. But let's go ahead and start over again and go ahead and tell the audience about Beach Medical. You have two locations, right?
Correct. Orlando and Claremont. Beach Medical is our medical practice where we offer our medical providers aesthetics and chiropractic treatment.
Mm-hmm. Is there one that's key, like the center, or do they all kind of work equally together?
They're pretty equal.
Okay.
I have an urgent care background, so really enjoy taking care of simple things. People are sick or injured, and our chiropractic team loves to take care of patients that were injured in auto accidents as well.
Mm-hmm.
We do offer all sorts of services outside of kind of the typical hospital-based primary care office. So
Right.
Primary care is kind of chronic disease management now, blood pressure, diabetes, cholesterol.
I mean, to me, just primary care is whatever the insurance companies tell them that they're allowed to do. That's the way I look at primary care. It's HMO, PPO, you're allowed 6.5 minutes with each patient. You don't really care what's really wrong with them. You're just going to find out what's wrong with them and give them a pill to make it go away. And then maybe another 6 other pills for the side effects of those pills and so forth.
Yeah, it's pretty awesome. Through my training, I thought that, as soon as you turn 40, you need to be on a blood pressure pill, a diabetes pill, and a cholesterol pill. And then got out of the training in the clinics into the real world, and blew my mind. There's 80-year-old patients that don't take any medicine. It's wow. So
that's just from taking care of themselves properly throughout the years?
Yeah.
Mm-hmm.
And I guess God created us to live, so.
I like the way that sounds. So, you and I are in the BNI together, and so that gives me the opportunity to hear you talk about your business on a regular basis. And so from what I find is different about your practice is that you do have so many things that you offer. And so you have aesthetics as well.
Mm-hmm.
Can we talk about that for a sec?
Yeah, so aesthetics, we focus on lasers, injectables,
Mm-hmm.
facial treatments, everything to help you look young, maintain your youth.
Right.
So
you make you feel better on the inside, but then we got to get the outside to match the inside.
Yeah. I try to just stay general
Mm-hmm.
and not label our clinic because we do everything, but some terms would be like an aging clinic or wellness clinic, but we also like sick and injured. So it's just really general. And aesthetics, we help people to feel and look good.
Right.
Today I thought we'd talk a bit about getting old and aging, and that kind of groups it all in the aesthetics,
Mm-hmm.
Hormone balancing, even physical fitness and
Right.
weight and everything. It's kind of a nice umbrella to put it under. It's getting old.
Yeah, it happens. I can't believe I'm 52. I blinked my eye and here I am. And I feel fortunate because I see like some of the people that I know that are my age or I'm older than that haven't held up quite as well. And I'm like, okay, thank you God for the good genetics. I appreciate that. But so I think a lot of it has to do with lifestyle too. I think quitting drinking alcohol really made a huge difference in the way that I look and feel on a daily basis. I definitely know it makes me feel better on a daily, feel better. So, all right. So getting old. So let's talk about some of the things that start to go wrong as you age that you can help with.
Yeah, we could start with skin since we're talking about aesthetics.
Okay.
So our skin, two of the main components are collagen and elastin. They're like these fibers that make up our skin. And as we age, those just kind of get old and shrivel up. And just like our skin, they also, like the hyaluronic acid, holds moisture. And so just as we age, our skin thins. And as things thin, they also sag.
Right.
Our nice chubby cheeks, we have fat pads in our face that give us this nice round
Youthful
appearance.
look, yes.
Yeah, and as we age, those thin out, and also as we diet. And so our face, common in our industry, starts out kind of U-shaped, and then it kind of goes to a V shape.
Yeah.
So we try to replenish that, and so the basics, moisturizer and sunscreen and good skincare to protect the skin. But then at our office, we can focus in on that collagen and elastin with a few different treatments. So we can do a laser treatment, and that stimulates the skin. Inside our skin, there's cells that make that collagen and elastin, and they will they'll get rid of the old and lay down new collagen and elastin. So we focus on stimulating that.
Right. So even though your body isn't producing it like it did, you can still stimulate it.
Yeah, it's still all there. We've got to trick it. And
Yeah,
one way to do
okay.
that is by using treatments that cause little microscopic injuries, like lasers and microneedling. You've probably heard of microneedling. Radio frequency is a key term. And so that takes these tiny little needles in, and for milliseconds, they heat up with radio frequency heat and cause tiny little injuries.
Like little nicks.
Yeah.
Okay.
Just at the right level of the skin. And then your body says, oh, hey, we need to fix this. There's a problem. And then it's kind of like when they resurface the 417, the crew comes out there and they take out the old concrete, old asphalt, and then they come in and lay down new asphalt. So it
Looks
by
good.
doing that, it stimulates your fibroblast cells to come in and remodel that elastin collagen. And then we can enhance that with our own body's cells,
Right.
through here of stem cells and growth factors. Well, we have our own stem cells and growth factors in our body. So one treatment is we'll draw your blood and we'll concentrate down the plasma into platelet-rich plasma.
That's PRP.
PRP.
Yeah.
And we'll put that in. And what platelets do is when you cut your skin, you bleed. The first thing that starts to clot are the platelets. They come and find the injury, they stick there, and then they recruit the clotting factors and the rest of your cells to heal. So we're going to concentrate that, and then we can inject it or do the microneedling and apply it afterwards. And now those little sticky platelets are going to find all those little injuries we caused and recruit your own body's
That's really
cells
cool.
to heal it.
Now, to become a doctor, learning all of that stuff, they don't teach in just regular doctor school, do they?
Right.
You have to get a special training for that part, for that piece, don't you?
Right.
Yeah. Because I think that's the big difference is that you had to do a whole different set of training, not just your regular go to college, get your doctorate degree, and open your practice. So actually, we're going to go to break. See that little clock up there? I can't remember. I don't remember if you remember that. But that means that we have 24 seconds. So we're going to go to break, and when we get back, we'll have more BaaD Radio. So everybody stay tuned. Welcome back, and this past portion of the show is brought to you by Body Street of Winter Park and in Winter Garden. Experience EMS Fitness Studio, where it only takes 20 minutes a week to get a full body workout. Visit bodystreet.us for your free trial. I was having a hard time with that one today. But have you tried Body Street? I can't remember if I told you.
I have not.
You're gonna have to give it a
should
go. Yeah. I got Maureen from our group to go, and now she joined, and it's really, really cool. You just go there once a week, you get strapped in, you go through a series of motions, and they kind of like put the impulses through you, like, and then you get little breaks in between, 20 minutes, you're breathing heavy, you're sweating, you're worked out for sure, and you can only do it once because it gets like every muscle part, and I've been doing it since November, and I've been super happy, like, with the results as far as...
We want to pump you up.
That's actually Stefan from Body Street.
Nice.
He's from Germany. All right. Sorry. Anyway, I started to like go off on a little tangent there. So we're here with Dr. Ryan Naughtin with Beach Medical, and we are talking about getting old, and it's unfortunately something that happens to all of us. And so, and Dr. Naughtin has all the things that help us stay and feel young as we possibly can as we age. They call it age gracefully, or is that considered fighting it tooth and nail because we don't want it to happen?
Aging gracefully is great.
Okay.
Yeah. So another area we could talk about are peptides and
I'd like to talk about
our
peptides.
regeneration.
Mm-hmm.
So peptides are molecules in our body, signal molecules. And the most famous ones right now are the weight loss peptides.
Is Ozempic and those guys, are those peptides?
Yeah, so GLP-1, GIP.
Right. I didn't know that those were peptides.
Glucagon-like peptide 1.
Mm-hmm.
Those are peptides, and the scientists have found, looking at our physiology, they find these pathways and say, well, we want to manipulate that, so let's do it in the lab. So they get these peptides, and they give them to us in shots, and all of a sudden, you know, the GLP-1s, they inhibit our hunger. They...
I heard they were good for your blood sugar, and
yeah,
there's other benefits to taking those other than just weight loss.
Yeah,
right?
it kind of maximizes your sugar and insulin, slows down your digestive system, inhibits your hunger, and stimulates your satiety, your satisfaction hormones of your stomach. So altogether, it's pretty good. But everyone knows about those. Let's talk about the fun ones. So the bodybuilding community has been using these for quite some time. So there's some that stimulate growth hormone, tesamorelin, ipamorelin, sermorelin.
I'm familiar with ipamorelin and butamorelin. Like, those are two, one my husband took and one that I took after we did we were kind of doing a fitness sort of like get buff kind of thing. It was fun.
Yeah, they stimulate your growth hormone. So real growth hormone, if your 12-year-old is never hitting puberty and he's only 3.5 feet tall, you take him to the pediatrician and they do some tests like, oh, he needs growth hormone supplementation. He's not creating enough growth hormone. So the bodybuilders are like, hey, we want some of that too.
Right.
And so the straight growth hormone is a kind of a controlled substance only to be used for those like pediatric cases and such. But then it's on the black market. So anyway, so now they found, instead of growth hormone, the peptides that stimulate growth hormone. Because in your body, most of your endocrine or hormone system starts at the brain from one hormone that signals some other gland to create something, right? Okay. So there's these peptides that you can inject that just lightly stimulate your growth hormone, which causes, it's kind of similar to like testosterone. It causes, muscle growth and strength and everything, which is pretty awesome. And it's pretty mellow. Patients will just do a course for like a month or two while they're working out, and it helps build muscle. And it also is one of the few things that can decrease that fat around your organs, the the stuff that's metabolically active, and it's the stuff that's really not good for you. So
what's the name of that fat that grows around your organs? There's a name for it because there's
Like-
visceral.
yeah, visceral fat.
Visceral fat.
Yeah, visceral means organs.
Okay, so because that's a different kind of just like I hate to use the word flabby, but like you know how you see some people and they're overweight, but it's solid as a rock. Like if you hit them in the stomach, it would be. I mean, it's just solid.
Like
but
Uncle Larry's beer belly, but it's
Yeah.
not beer. It's just like.
But I mean, that's visceral fat versus like just regular.
And it's even worse,
right?
Worse for your hormone system. So it's nice to be able to target that a little bit.
Help people not.
Yeah, a lot of the patients they'll do like a 1 month course, take a month off, kind of stagger it to just kind of helps them get lean and cut and strong.
I did hear a while back. I mean, when I say a while back, I'm just like a few months that they were going to be banning peptides like the ibutamoren and the ipamorelin because they just weren't making money off of it. Or I mean, it's obviously good for us, right?
Yeah.
So if it's good for us, then somebody
Wants
somewhere
to make money
wants to make money off of it. So they're going to ban it until they can figure out how to
control it. Yeah. So it's outside of the FDA and the big pharmaceuticals manufacturing control.
Mm-hmm.
So it's got to go.
Yeah. So what happened with that?
I'm not sure.
But you have compound pharmacies that will still be able to make it.
Yeah, peptides are actually generally supplied as kind of like a raw product for experimental use.
Okay, so how do you prescribe that then?
You don't prescribe it. The patients can just buy this product, and they can buy it online.
Oh, okay.
And some of them you need to buy I don't think it's the legal route. I mean, it's not illegal, but the peptide manufacturers will only provide it to medical doctors.
Right.
So that just the general public is not buying it from them.
I got you. I'm like, I can get on Amazon and buy myself some ipamorelin. I'm like, okay, I'm on there right now.
You can actually. You can get any of it. Then some of the companies need to go through a medical doctor, which I think is a pretty good idea.
I think it should be supervised for sure. Because you don't know how much to take. I know what I took was ipamorelin, and it was almost like a little gummy, but you just put it in your mouth and you let it dissolve. And I would take one a night. And then I can't remember what Tom's was. But now, like I'm on estrogen, progesterone. Like I said, I'm through menopause, and Tommy will take testosterone. And what does testosterone do to women? Like other than, should women take testosterone at a certain age to help them with energy? I mean, like I'm not interested in becoming a man or anything like that, but I've heard that there's some benefits to it.
Right. Both genders have estrogen, progesterone, and testosterone, just in different levels.
Right.
And both genders, those levels all decrease as we age. And so it's a good option for ladies to have a little testosterone supplementation. It helps with muscle mass, energy, libido or sex drive, dryness. So the full spectrum for balancing your hormones.
I don't want to grow a beard.
Usually involves all
I'm not
three.
interested in chest hair or any of that stuff.
And
I definitely don't want my body to get square. I don't want I don't want anything like that. But I mean, everything you said before that, I like the energy and stuff like that. I'm down for that because sometimes I get so tired that I'm just like, why am I tired? I shouldn't be.
Yeah, and the dose for a lady, for example, is probably like 2 milligrams a day, and for a man is like 200. So
okay,
it's just like a little
drop.
Yeah.
Well, that makes sense. So
yeah, so hormone balancing or supplementation, from the doctor's perspective, should be pretty subtle, and compared to anabolic steroids, Arnold Schwarzenegger injecting a huge amount for aging gracefully. We just want to supplement a little bit. The simplest way. Are we going to break?
Yeah.
All right. Remind me. We're going to talk about capsules.
Capsules. All right. Well, we're going to listen to some Blondie for a minute. So, all right, you guys, we're going to go to break. When we get back, we'll have more BaaD Radio. So stay tuned. Welcome back, and this portion of the show is brought to you by Ground Up Property Services. Do you know what your sprinkler system did last night? Probably not, so now's a good time to get your irrigation system serviced by Ground Up Property Services today. And be sure to ask for a call with Ground Up about our water sensor too, so your lawn doesn't get too much water. Call 407-468-4295 or visit groundupinc.net. But I said this last week, it's so hot out, it doesn't matter how much water your lawn gets, it's going to dry up. All right, so we're here with Dr. Naughtin with Beach Medical, and he wanted to, I want to hear more about peptides too, because we are talking about getting old and the things that Beach Medical can do to help us age gracefully, naturally, but not have to like speed through it. Like, right now it seems like you wake up one day and one eye is drooping down to here with absolutely no reason whatsoever, and we just don't want that. So let's keep talking about our peptides.
Okay, so we talked about the growth hormone stimulators. Then there's some for kind of anti-aging specific. The most common one you hear from our friend Joe Rogan is BPC 157, which is body protective compound 157. And it helps with healing soft tissue injuries, muscles, anti-inflammatory, helps with GI problems like leaky gut and irritable bowel syndrome, and just general inflammation. So I don't know about you, but I remember a couple years ago doing some hurricane cleanup, and afterwards, like, my hands hurt. And I was like, what the heck? Usually what I say is in your 20s, you have pain if you do something stupid. In your 30s, you have some pain after physical labor. In the 40s, you have pain during physical labor. And in the 50s, you have pain before you even do anything physical.
You just have to wake up in the
morning. It's just like I'm in pain all the time. Yeah, so something like this is a great option to just kind of calm down the inflammation in your body. So it's also a good one that our fitness buffs
Why does our body always want to get inflamed? Because inflammation is what causes all the problems, isn't it? Like weight gain, pain, it's all inflammation, right?
Yeah.
Why?
I don't know. A whole nother topic will probably be like our American diet and everything that goes there, which I'm not an expert on, obviously. But inflammation is just kind of, I just blame it on Eve for eating that apple and, bringing it as a state where we age and get old and die. It's just like, we're buying time, and as that inflammation revs up, I think it's just the nasty part of the aging process. And eventually, if that inflammation in your hip doesn't go away, it burns out your hip and you need a hip replacement type thing. So, it's something that I try not to let get out of hand. If something flares up for a day or two, great. But if it's going on for a week or a month, we should probably do something about it. And good option are these peptides compared to steroids like prednisone, dexamethasone, or taking ibuprofen every day.
Yeah, like I say, those are just to stop the pain, right?
Yeah, if you find yourself eating ibuprofen like it's a vitamin, this would be a good option.
Are all of the peptides, or do they come in different formats? Like some are pills, some are injections, some are like just liquids.
Yeah.
How do you consume them?
Yeah, I like the injectable ones. They come in a little vial, and you use an insulin syringe, like the tiny little 32 gauge needle, and you can do an injection. We come up with a routine if it's nightly or every other night or twice a week.
If somebody's really got the heebie-jeebies about that, though, can they arrange just?
Yeah, they have some that'll dissolve.
Oh.
Yeah, we'll come up. There's some just tablets you eat. Some dissolve in your cheeks. Some are the shots.
Because not everybody's comfortable giving themselves or somebody else a shot.
Yeah, like with weight loss, you just stop by the office once a week and
how it works?
Get your
if you can't do it yourself,
injection.
Then you schedule it.
Yeah,
okay.
But if you're cool and can handle it, you come by once a month, and then we send a few shots home with you. So then we still monitor you about once a month.
The funny thing is like I can't even look at a skin knee anymore. Like it just gives me, but I have no problem like giving Tommy his testosterone shot or giving myself a shot or anything like that. It just doesn't faze me at all.
Yeah. And then there's several peptides kind of in this category. So we have a manufacturer, a lab that supplies us, and they will blend this one has 4 different peptides in one shot. So you don't have to give yourself 4 shots.
Nice.
It's just one shot. And we call this the Warrior formula. It's got BPC 157, TB4, MGF, and KPV. And now I'm speaking code.
I know.
But
my programming.
Trust me, it's a good combo. Sometimes they call it like the Wolverine formula because like Wolverine regenerates so amazing. But it's not that dramatic.
Is that one for men or for women or
either?
And is it? But it's when you're in a cycle of trying to build muscle.
No, this is more in the anti-aging category. So anyone can do this, regardless if you're trying to get.
Is this something
fit.
that you came up with at Beach Medical, or is this something that like the industry's come up with?
The industry, and then I have a representative that is really into this, and he sought out and started his own company and approached me and was like, "Hey, what do you know about peptides?" I'm like, "Nothing," and he's like, "Well, I've got this great solution," and he's helped me to get it going, and he's one that requires a doctor to access these, so I'm his doctor, and we have quite a few people that are.
Can you tell me like some stories about some people that have tried it and have really liked it?
I have several. It's generally
you don't have to give names. I know there's like the whole.
They'll.
I just like to hear when somebody started it and they couldn't lift like this, and then now they're doing this. I love hearing like kind of results.
Yeah, just general overall. People are kind of breaking through those plateaus and getting their body composition that they're looking for, because we can kind of target that stubborn fat and build muscle without a lot of side effects. Like testosterone has some side effects.
I know.
To do the large doses. This is I'm comfortable with it. It's a subtle, we call it biohacking, subtle tweaking of your own physiology.
Do you take it?
Just to supplement. I have done some courses like for a month when I'm motivated and going to the gym. I did the growth hormone cycle for a month, and I felt more tone,
right,
and a little more cut.
I just know you travel and do a lot of stuff with your church, so it's probably hard for you to stay on a regular schedule. Huh?
Yeah, I've got my Crunch Fitness Pass going on right now. And as I run around town, I have my gym bag, and I just pop in here or there and lift a little bit.
That's a good thing because there's a Crunch Fitness everywhere.
Yeah, I'm a big fan of the Crunch. There's another formula. So I have the growth formula. That's the growth hormone stimulator. The Warrior, which is the regenerative anti-inflammation. And then this one's for the ladies. It's called Glow, and it has that same BPC 157, TB 500, and then it has this copper-based peptide called GHK, and that helps your skin to glow.
Oh, okay. I've seen. I think I've seen somebody take that before, and I was kind of amazed.
It helps with your hair, collagen, skin tightening, the elastin. It stimulates those fibroblasts that help create all that. So it's a really good combo. They come out to about $150, $180 a month.
That's about normal. That's about average.
A lot less than Starbucks.
Yeah, no kidding. Is that one that you cycle, or is that one that you take every day?
Yeah, and on these ones, we kind of make up whatever works with someone. Often I have them do it every other day. Just because giving yourself shots every day is
a lot.
Hard work. Every other day is not too bad, or twice a week. And so this one, I have a lot of ladies that are on the weight loss GLPs and this, and it's a good combination.
Oh, they're probably so happy. They're losing weight.
They're working on our skin. We're losing weight. Yeah, it's a lot of fun. So.
I loved the Ipamorel, and when I took it, because I was starting to get my body was starting to get that square older lady square look, and then it helped me like start to look like myself again with like a woman. Yeah. So, all right, we're gonna go to break, and when we get back, we'll have more BaaD Radio. So stay tuned.
together.
Welcome back, and this portion of the show is brought to you by Frogger's Grill and Bar. Looking for a place to go with friends or meet new ones? Then you're looking for Frogger's Grill and Bar, and with 4 great locations, there's bound to be one near you. Oviedo, Mount Dora, Popka, and Altamont Springs. And visit froggers.com for more info. Frogger's Grill and Bar, hopping with food and fun.
Yeah, boy.
There, we got it that time, Ken.
And what day of the week is Frogger's Cheeseburgers on special?
Wednesday.
Wednesday?
Wednesday.
Yesterday, obviously.
Yeah, Wednesday is $7. It's not just cheeseburgers. It's every burger on the menu, and some of them
like blue cheese, black and blue or something. I've been there. They've got some serious burgers.
Yeah, they're so good. Yes, yeah, I'm getting a Frogger's order right now as we speak through my headphones. Yes, the 2 locations, Mount Dora and Altamont Springs, have what do they call it, a brick oven or whatever, so they can do like the calzones and the flatbreads and things like that. But Oviedo and Apopka don't have those. So when we do events here, they'll bring those because it's closest to the Altamont location, and so we'll do a food drop here, and the other people that work here get to try it. So,
you've got the inside. All right. Cool.
Yeah. That's one of my perks of being a marketing person. So anyway, so we're going to talk about you now. So we're here with Dr. Ryan Naughtin with Beach Medical. Is the cold starting to get to you yet? It's like 40 degrees in here.
I'm all right. I'm from Idaho, so I can handle this.
I'm surprised that we can't see our own breath in here. It's so cold. But you know what? I brought my big sweater today because Ken was nice enough to text me this morning and tell me to bring a coat. So we've been talking about peptides, and you mentioned something about making this, like you said, building a landing page so it can be on your website. So is this something that you really are going to dive into with Beach Medical as far as like offerings? Because one of the hard things that I see about your practice is you have such a wide variety of specialties that it can be challenging to like market all of them at the same time.
Yeah, and I've given up on trying to tackle that. I'm like, yeah, if you have your primary care doctor that does the blood pressure, diabetes, and cholesterol, we do everything else.
Yeah.
So all the fun things. So, what happened is I think medicine used to be like that. There's the town doctor.
Yeah.
He'd take care of everything. And then they've tried to make it so efficient and high volume with the hospital systems and making money that they've lost
the humanity
lost that.
part of it.
So at B&I, when I was developing my introduction, I'm just kind of like the plumber or the air conditioning guy, right? So if you have a problem with your air conditioning or your plumbing, you just call Alicio and be like, my air conditioning is not working, and he takes care of it. That's kind of the medicine I practice. Like if you have a problem, just come see us, call us. We'll identify the problem. We'll figure out the solution. And we have several different treatments. You know, it's overwhelming on the website when you go through the treatments. I try to narrow it down to kind of complaints like injured, illness, wrinkled, fat, dry.
Well, I mean, I think probably the biggest concern would be people not knowing, first and foremost, especially the elder, not when I say the elderly, the Gen X and above is going to be like, do you take insurance? The younger generation is more open to concierge type of medicine, and they also don't mind investing more in their health and wellness as opposed to like us. We've been brought up is that you grow up, you get a job, you get your insurance, you follow the rules, you do what you're told to do, and end of story. But the younger people, they don't.
Yeah, and you gradually collect more and more prescription bottles on your bathroom counter until you die, and then
that's so true. God, it's so true. But you your Beach Medical is not in that scope of things, so I can see where it'd be challenging to get people to break through, like somebody like myself to break through, and be like, okay, I'm not going to go to my primary care for this and that because. First of all, they can't get my address right, so they keep messing up that with my insurance, and then my insurance will only cover this much of it, and then they can't get me in until Tuesday and 3 months from now, and there's just I hate it.
Yeah, we're more that concierge approach where you can text the office, and we don't have like 10 people preventing you from speaking to me. And I text patients, I give them a call, and it's kind of that problem based. Like, what do you need, and we'll take care of it.
Well, you also do house calls too, don't you?
We'll do house calls if you need it. It costs a little bit more, but
I can imagine.
If you're sick and puking with a fever of 103 and you have the flu, I don't really want you coming to the office because you get everybody else sick. So myself or a nurse practitioner can come out to your house and give you an IV and some medicine, check you for the flu, and maybe pull some labs while we're there, send them in overnight, and so that if you're not feeling better the next day, we have a pretty good idea of what was going on. And
right. Well, what I really want to do, because this is our last segment, but what I want to do is to talk about, and let's finish up the peptide conversation so that we can have that and then next time you're on, we'll talk about like the next thing. But
stitches or something.
Yeah. So how do you go about like understanding? I mean, does everything start with blood work?
I'd like to say yes. Blood work gives us a pretty good idea overall, but most of the time, if you come in, it's going to be fairly normal. Most of us, middle-aged, trying to be healthy people, are going to have pretty normal blood work. We can look at a few other things, but it's really reassuring us that there's nothing crazy going on.
Right. Crazy as in like
leukemia or something,
okay,
right? Like you got to check your blood work every once in a while and make sure, you don't have like
autoimmune
or
something like
blood
that.
cancer or something. Your cholesterol's off the chart or something.
Right.
It's nice to, even when we're talking about menopause and hormones, we're going to check all of those just to give us a pretty good idea. Make sure it's not something sneaky like your thyroid, which is super common. All the vaccines knock out your thyroid. You wonder why everybody's needs thyroid pills because our favorite.
I have to take thyroid medication.
Yeah. But anyways, the question is, so if you're interested in this, come in for a consultation. Most people haven't had decent lab work, so we can, besides just those typical primary care cholesterol and things, we check your hormones. Everything is pretty reasonable, a couple $100. Give us an idea, and then kind of see what your concerns are, how you're feeling. And then kind of go in that direction, whether it's glow peptides and a hydrofacial and more down kind of the aesthetic beauty line, or if you're overweight and you want to lose some weight, we can get you started on some of the weight loss peptides right away.
I didn't know that those were peptides. That's kind of cool. I mean, I thought that Ozempic was something that was for blood pressure medicine, and they just figured out that it's
for diabetes. And they're like, wow, everybody's losing weight. This is great.
Ozempic made me so sick, though. God, it made me.
It's pretty rough. That's because diet, the first three letters is die. So
it made me feel terrible. I couldn't take it.
It's nice to do for a month or two, lose your 10, 20 pounds, and then come up with a plan to keep it off. And a lot of that will be balancing the hormones. So, come in, get an appointment. We'll check those things out with me or one of the nurse practitioners, and then come up with a plan. We keep these blends of peptides at the office.
Really?
For you.
Okay. So when you go there, you can prescribe it, and then you can walk out with it?
Yeah.
Okay, that's really cool.
We'll teach you how to do the shots, or like I say, you can come in, and we'll shoot you every once in a while. Other than that... then we can work on other things. I have two amazing chiropractors in the office that don't just crack your neck and back. They'll work through all your muscles. Dr. Osie's created his own techniques.
That's really cool.
Versions of applied kinesiology and different things. They're real experts. We handle professional athletes, recovery and training. They're amazing.
So this is where we're going to have to wrap it up. So give everybody all of your contact information for both locations.
Like verbally?
Well, yeah. Well, how do they get in touch with you?
beachmedicalflorida.com is our website. Same thing on Instagram, TikTok, Facebook. Office in Orlando is at 401 Mills. It's like Mills, Colonial Town, area by the YMCA and the Girl Scout cookie headquarters.
Awesome.
And then Claremont is on 50 across from the big new Costco and White Castle.
All right.
Which I have to go check out.
Well, thank you so much, you guys. Thanks for tuning in and have a great week.
All right.